Thank you, everyone. My name's John Sproul. I'm Senior Policy Director with the Institute of Health Economics, and happy to co-host this event with the O'Brien Institute. Just a couple of logistical things. One, we are videoing the morning's sessions, just so you know, and so they're webcasts, so other people around the province are able to join us for this participation. Happy Valentine's Day. I hope you all came with great passion for the discussions today. And that can be maybe a running theme through the day of what we're passionate about in terms of the great opportunity I think that exists in Alberta. We'll be having a session this morning which was open to broad invitation, and there'll be some further follow-up discussions, and Bill can explain that are happening this afternoon with some select stakeholders to kind of build on some of the discussions this morning. But I'll call on my colleague, Dr. Bill Galley, to introduce our first speaker.
Director of the O'Brien Institute for Public Health at the University of Calgary, and I'm delighted to be here on behalf of the O'Brien Institute at the University of Calgary, co-hosting with the Institute of Health Economics this very important symposium that I'll frame just very briefly in some opening comments. The first thing I just wanted to say is that we have really enjoyed our partnership with the Institute of Health Economics over the last few years as an institute at the University of Calgary, and have had the pleasure of co-hosting a series of policy symposia where we have had a really exciting partnership that I would say has four key ingredients. Certainly our two institutions that are working to bring health policy matters to the forefront and to have important dialogue. The Ministry of Health and Alberta Health Services have been very significant partners in those symposia that we have staged, and obviously that's of great relevance because those who make decisions for our health are in those entities. And then the last key ingredient has been the provider communities and citizens who are the recipients of health care and health policy. And we have had in these exciting symposia events and important events the engagement of multiple stakeholders, and that's really, I think those are the key ingredients that bring us into a place where we can have meaningful dialogue around issues that matter. So that's really the first thing to say in opening. Today is a symposium that focuses on health information exchange, and our shorthand term for describing today is that this is an e-health policy symposium. And this is really a lot more than a symposium. This is simply a checkpoint in a longitudinal change process that I want to specifically mention Kim Waringa, the Assistant Deputy Minister overseeing policy initiatives relating to health information and really care integration through e-health, and Carl Amrine, the Deputy Minister of Health, and of course with the backing of Minister Sarah Hoffman and the provincial government. There is a real commitment to changing paradigms of care in this province, and I think there is a real sense that Alberta is in a strong position to do so because of the significant achievements that have been reached in the domain of e-health to date. So what today is about is it's not really about the technology platforms that can enable new paradigms of care, because in many ways those already exist, those are in place. It's also not specifically about ethical legal considerations around sharing of health information, though obviously there can be some discussion in that domain. It's more about the policy context and the people, the players in an e-health context, and what the new opportunities are for individuals and what some of the new accountabilities might be, and what the policy framework might need to be to achieve a new state. And today, as I said, is not a symposium for today and today only. It is Valentine's Day, John, but it's about more than that. It's about a process, and there will be a real focus through this morning's open session and then a closed session in the afternoon with leaders of key stakeholder entities like the Alberta Medical Association, the College of Physicians, the Nurses Association, Pharmacists Association, College of Pharmacists, et cetera, et cetera. Many stakeholders are here to talk about what the next phases look like. There is a policy white paper that has been developed in preparation for today. Dr. Doreen Rabi and Kim Waringa, Bilal Shamali at the University of Calgary, and others were leaders of this policy white paper. Many of you picked up copies as you came in. There are some copies on the back table at the right, so if you don't have this, you can certainly pick this up because this is part of the roadmap forward that is being discussed today. So do look at this as the day progresses. So without further ado, I'll just transition into introducing the next speaker in the program, and I already mentioned his name. Dr. Carl Amrine is our Deputy Minister of Health. He is also an urban planner by discipline and was provost at the University of Alberta. I was about to say University of Calgary, Carl. I don't know if I'm foreshadowing anything there, but provost at the University of Alberta certainly is familiar with both university sector, government sector, and how the types of collaborations that we're seeking to achieve today can be very fruitful. So with that, Carl, I'll turn it over to you and let you set the stage for today. Thank you.
Good morning, ladies and gentlemen, and thank you for coming this morning. It seems that many important events over the last 20 months or so in the evolution of the health system seem to take place in this room, including another event that was co-organized by the Institute for Health Economics and the O'Brien Institute that focused on the role of physicians in co-managing the healthcare system. And that event preceded a series of discussions with the AMA that gave rise to what some call a very unusual and perhaps remarkable amending agreement to the AMA, a document that is shared with the government. And I think there's lots of AMA people in the room here. I think I saw Mike Gormley in the room here today. So congratulations to Mike and his team. We are well into the implementation of that amending agreement, and today's discussion is part of it. And I would like to note the role of the O'Brien Institute and IHE. I had the pleasure of meeting Mrs. O'Brien in Calgary. I don't know if she's listening. I hope she is, or you can clip this and send it to her. I don't really know what she imagined the O'Brien Institute would do, but since I've come to the world of health about 30 months ago, the O'Brien Institute has been ever present in bringing forward important conversations, and the document that is before you today is just another example. So thank you, and hello everyone. For those of you who traveled here today, welcome to Edmonton, and for those of you that had a memorable journey traveling here today, we're very pleased to see you safely in Edmonton. It is a pleasure to join you this morning and bring greetings on behalf of Minister Hoffman, Associate Minister Payne, and all of my colleagues at Alberta Health. Collaboration between government, health professionals, researchers, and patients is very important. I'd like to thank everyone who had a role in helping to organize today's eHealth Policy Symposium. I know today's sessions will be very thought-provoking, and I very much look forward to hearing your insights and suggestions when it comes to greater integration of digital health information. The evolution of healthcare is only possible through the sharing of best practices and innovations at events like this symposium. You may have read the recent speech that Minister Hoffman gave at the Primary Care Conference outlining a vision for healthcare in Alberta. This speech gives direction to the ministry's goal of delivering the right care at the right time in the right place with the right healthcare team using the right information. This vision asks that we shift our traditional focus from hospitals and facilities to a more community-based care closer to home. It's a vision where healthcare is planned and structured around people and their communities, always recognizing that we will continue to have the need for the very best hospital system in the country. It is a highly collaborative vision where community-based care will be provided by a team of healthcare providers, and Albertans will have an active role in managing their own health. Improving the exchange of health information is essential to adopting a collaborative model of integrated and community-based healthcare. Alberta has long been regarded as a leader in Canada on the e-health front. This was reinforced during a series of conversations last week in Minneapolis that I had along with John Spruill. So you can ask John for the details throughout the day, but the leadership of Alberta in e-health is not just in Canada, it has spread south of the border. We are currently investing $400 million into a new clinical information system for AHS that will bring all of AHS health facilities and the vast majority of its 1,300 different clinical information systems onto a single platform. This will help reduce disjointed care, gaps and overlaps, errors, and delays. A single source of information will support team-based care, ultimately helping AHS professionals provide the very best possible care to Albertans. We are also making progress when it comes to adding community health care information into NetCare. When Albertans visit doctors' offices or other clinics outside of AHS, this information will be added to their electronic medical records. This will help ensure providers have access to the information they need, where and when they need it to provide the best care possible. Albertans themselves will be able to access their own medical records online, and Kim can provide more details on the timelines. Kim Waringa is in charge of this magnificent, revolutionary undertaking. When the personal health record goes live, Albertans will have a secure place to record their own health information, as well as access their prescription drug information from Alberta NetCare. In spring 2017, we expect results from approximately 50 of the most highly used lab tests to become available to patients who want to view and access their own results, followed by access to their immunization history. We want Albertans to have access to their entire personal health record. One person, one record. As a result, they will be better informed and better able to make decisions affecting their own health care. And while we have made bold strides when it comes to e-health, there is still a great deal of work to do, which is why our gathering here today is so important to the government. It is only by coming together and pooling our various experiences and resources that we can develop a fully integrated healthcare system that meets the needs of all Albertans. 10 years from now, or maybe 5 years, or maybe even sooner, Kim, I'd like to see the AHS clinical information system fully deployed across their organization and Alberta NetCare capable of two-way health information sharing that supports clinical decision-making and advanced analytics, with community information from electronic medical records fully available in NetCare. I'd also like Albertans to have full online access to their own medical records, with the ability to sync medical and personal health gadgets like Fitbits to these records. With proper support, Albertans will be better informed and more engaged in their own health and their own well-being. Imagine a future where each Albertan linked to a primary care physician can have their health status monitored as part of a primary care network developing team-based care. This is the vision that is embedded in the AMA amending agreement signed by the AMA and the government recently. Your expertise and input is invaluable as we work to ultimately change the way healthcare is delivered in our province. Secure and reliable access to high-quality health information is essential to providing integrated health care. And while digital infrastructure is an important piece of the puzzle, legislation, policy development, and change management are equally important when it comes to the digital exchange of health information. There are two crucial considerations as we move forward. First, how our healthcare providers engage with the health system, and second, the safeguards in place to ensure responsible access and the use of personal health information. Today's discussions about e-health will build upon the great work that is already taking place on the front lines in our healthcare system and in our communities. We have a couple of papers that will inform our discussions today, and I think those have already been mentioned. The white paper, Engaging Providers in Healthcare Information Innovation, contains a number of recommendations that call for action. The College of Physicians and Surgeons of Alberta roadmap toward an electronic patient record provides great insight into the important role that physicians play when it comes to integrated health information. I also hope to explore how Albertans themselves can be engaged in the process of moving towards more integrated health information. When launched, the personal health record will be an important tool for Albertans to move towards greater ownership over their own health information. We each have a role to play when it comes to innovation in our healthcare system, and we each have a unique contribution to make. When information does not flow between the various components of the healthcare system, patients suffer needlessly, and badly needed resources are wasted. Our vision of modern healthcare assumes, and in fact requires, extensive information sharing in the digital domain. Secure and reliable access to patients' personal health information, as set out in the Health Information Act and other legislation, will determine our level of success when it comes to the delivery of integrated health care. It is through the active participation of everyone in this room that Alberta will continue to be a leader when it comes to e-health. The health information infrastructure that we invest in today will help lay the foundation for the healthcare system of tomorrow. Thank you all for being here, and I very much look forward to the outcomes of all of the conversations that will take place throughout the day. Thank you, and good morning.